Kevin Hardy from Hardy Group. We're at the Nepean Blue Mountains Health Conference on Together Achieving Better Health, and one of the keynote speakers at this conference is Dr. Michael Cleary, who is the ED, PA and QE2 Health Network in Brisbane South Health and Hospital System. And we're talking this morning about the digital hospital. Brisbane South has been the leader in this regard in Queensland. They've been at the forefront of implementing it all. And so we're going to talk about the digital hospital and how it's gone. So welcome, Michael. I appreciate your time. And just a few questions. So I've said that Brisbane South has been the leader in this in Queensland. So can you tell me a little bit about what was the vision at the beginning of this whole process, and what's been achieved so far?
Well, thank you very much for the opportunity to meet. I think the big thing for the healthcare system in Brisbane and in South Brisbane in particular has been a vision of really connecting people, not only connecting clinicians to patients, but also connecting patients in their journey between different elements of the healthcare system, be it primary care, community care, or hospital care. A lot of the work that we had done really provided the platform for us to go forward and put all of the hospitals in Metro South on a digital platform, and that means we now have coverage of about 1.1 million people with that digital platform.
Well, it's fascinating, isn't it? Because when you're the leader in this, obviously you're stepping out and taking a risk as well, and it requires a sense of courage and commitment to that whole process. What's been your learnings from it all?
Well, as you say, it was an Australian first, and so it was a challenge because you really couldn't go somewhere else and see how they did it. Also, internationally, very few health services have actually gone to the extent that we did in terms of implementing a comprehensive digital record. Many health services have implemented component parts, and in America, obviously, a lot of those component parts are geared towards the private sector. So for us, I guess the things that we learnt were the importance of patients to be at the centre of any discussions around the digital platform, and to make sure patient care had primacy in that. And then secondly, to ensure that you focused on the staff that were going to use the system. And to that end, we had very senior staff embedded in the project right from the very beginning, and that included senior doctors from emergency medicine, internal medicine, intensive care, and cancer care. And that meant that you had very senior clinicians who were there to drive the principles that needed to be articulated to the project team. We also had the most amazing people from our nursing and allied health teams embedded. Amazing because they really took this on with great vigour and looked at what sort of process redesign or clinical re-engineering needed to occur within the hospitals to make sure that the new digital system had the right structure to be able to improve care. And in some of our clinical units, because of the device integration we've seen up to 25% reduction in time required to document activities, and that's really freed our nursing staff in those units up to provide more patient care and more time at the bedside.
And more timely care, because real-time data is feeding in to people's thinking and decision making.
Well, one of the things we did right at the very beginning was to establish a data governance group, and again we looked at what had happened in centres worldwide where they'd implemented similar digital systems to see whether we could learn from them. As far as we could see at the time, there were very few large hospitals that had gone down the pathway of presenting data in a digital format to clinicians on the ground at that really granular level. And as a consequence of that, we set up our own small team internally and went about developing digital displays for our clinical staff. And those displays cover areas such as quality and safety standards, operational management, but there are also important displays for our clinicians at the bedside. So nursing, for example, has a display which is now used widely for nursing handover. So instead of having to print off the list of patients or look at the board in the staff station, you can now use the digital display to run through the patients and identify which patients need to have particular follow-up, like pressure area assessments or falls assessments. So it's been quite valuable having real-time data available to staff at the bedside so that they can improve the care and treatment of patients.
Well, that's fantastic. And do you find now, as the clinician engagement, so critical at the front end, but as they gain more and more experience with the system, they start to ask questions about what if we did, or can the system do this for us?
So you're quite right. As people have become more comfortable with the system, they're starting to say, what more can I get out of it? And that's led to us developing a series of digital displays for particular groups of clinicians. Things like our smoking cessation program, which is ever so important for preventative health, and it's an important program for us within the hospital. We now have the ability to present a graphical interface of the types of activities that are going on in the hospital, how successful they've been at stopping people smoking, and that's really meant that we can reduce the administrative burden that used to be there to collect this data, collate it and analyse it. And the data is also real time. I think we've seen quite a number of people ask about those types of information. The other big area that people are interested in is research, and we're one of the few hospitals in the world that's introduced the research module with this implementation. And that means that you can much more easily recruit people into research programs. You can make sure the documentation for those research programs is online, and for the clinician, and my background is in emergency medicine, as you know, it means now, rather than having someone turn up to the emergency department with a card that says, I'm on a research project, it involves Dr. Smith, if you need any help, bring Dr. Smith. In fact, the information that you would require is stored in the electronic record system. You can read the research protocols, you can see what is happening, you can understand the research, and I think that transparency is very important. As a principle, one of the things that we've seen with the introduction of the digital systems has been what we've coined digital transparency, where information previously that wasn't available or was hard to find is now there and at people's fingertips, and that improves the real-time decision making.
Okay. Like any large organisational change process, there's the people who start the process who are out there out front, and then you get early adapters and late adapters and so forth. Are you finding that those early adapters and those who are considering taking it on in 12 months or 2 years' time are asking for information and advice from you about all of this, or?
Well, certainly we've seen the number of people visiting the hospital to look at our digital systems has increased significantly. We've almost had to have an event coordination function established now, and that's not unreasonable. And we welcome the opportunity to demonstrate some of the systems that we've got, but also to talk through some of the problems that we experienced during the implementation and go live. And that's really so that by sharing that information, other people are at least aware of it or can avoid those risks.
Absolutely, great learning for them through your experience. Yeah, no, exactly right. So what's next for Brisbane South in the digital world?
I think this is really just a beachhead in many respects. This is the start of a digital journey, And for us, the big components that we haven't yet picked up on are going to be things such as the patient portal. Now that's possibly a little way off yet, where patients can access the systems, because clearly they won't access the systems the same way as the clinicians do. They'll access them differently. I think the remote access, which is also very important for clinicians to be able to access the systems from home or from a remote location, is another area that's probably easier to solve, but we have to get around some of the confidentiality and privacy and security issues before we do that. We are currently feeding our information into both the My Health Record system and into the Queensland product called the Viewer, which provides GPs access to our information. And as time goes on, I think those types of products are going to become even more important for our patient cohort, because that does really give them the opportunity to see what's happening in general practice or in community or in the hospitals, and have some control over those records and how they're used.
Okay. One last question. This will have caused some change to your workforce. How significant has that been?
We were fortunate in that although there has been change to the workforce, it hasn't been dramatic. There are probably a couple of reasons for that. The first of which is that in parallel with us going live with our digital hospital, the undergraduates coming through the various clinical training programs, medicine, nursing, allied health, also commenced using our record system. So undergraduates in medicine at the University of Queensland have been using the digital systems for 2 years before they graduate. So moving to the digital hospital is relatively uncomplicated because they've had experience over the last couple of years. They do, however, require more access and therefore additional training. In terms of the existing staff, we trained nearly 6,000 people before we went live, and we have a program to induct people when they start with us, and that training is very comprehensive. It's 12 to 16 hours of training, and then there's a proficiency test at the end to make sure that you can use the system. So
great.
That's been a big component of our change management. And then within the health system in Metro South, the digital systems offered us an opportunity to change our work practices, and those work practices have been adopted across all of our hospitals. So if you work in multiple sites, or if you move from one hospital to another hospital, you still have the same systems and the same processes in place. And I guess you could say that's reduced the complexity of the training requirements, because in previous years you might have had different methods of operating in the different hospitals, but now with the digital platform, really there's a fair degree of standardisation of practice as a consequence, and I think that's improved the reliability of us as an organisation to provide a high quality care in a standard way, and where we know the outcome is going to be high quality as well.
Fantastic. Thank you, Michael. Thank you so much for making your time available. It's been an absolute pleasure talking to you, and I look forward to the next time we talk.
Thank you very much.
Thank you.